Mother's response to a child's fever is our day-to-day problem of a pediatrician's life. Pediatrician knowing everything about fever is not enough. Mother has to know. Mother is the caretaker and pediatrician is the advisor. Pediatrician's role is not diagnosing and prescribing medicines for fever. Pediatrician's role is contact with a knowledgeable or well-informed person. Mother's contact with a knowledgeable and well-informed person. Fever is a friend. It fights diseases. Fever is not a disease. One can have a common cold fever, which may be insignificant. One can have fever with typhoid, gochita, rickettsia, dengue, malaria, rheumatoid arthritis, malignancy. Tuberculosis. Fever can be due to anything. Fever is a symptom mother brings child to you and is a sign we observe the temperature, height of temperature. Fever is a friend, it fights diseases. Most of the viruses and bacteria are thermolabile. To kill those viruses and bacteria, body raises temperature. It is a defense mechanism against infection. But all fevers are not due to infection. In summer, rising environmental temperature is also a cause of fever. Body has a thermoregulatory mechanism set up. The thermoregulatory center is in brain. So mother should clearly know when she has to worry and what she has to do. Fever, go to a doctor, is not the right way of management. Mother has to assess whether this fever is significant or not significant. That means mother should worry about or should not worry about. Height of temperature does not indicate seriousness of the illness. High fever, 101, 102, child may be active, playing around, dancing, singing, eating. So there is nothing to worry about it. But 100 fever, child may be sick. Child may be serious with 100 fever. So height of fever is not direct relation with seriousness. Duration does have a direct relation. All viral infections are within 5 days. Bacterial infections are beyond 5 days. Bacterial malarial infections are beyond 5 days. Bacterial infection child with fever look sick. Viral fevers, child does not look sick. So important is child playing around, eating well, looking sick, duration of fever. Mother has to notice and take a decision what to do for this. Every fever is not an indication of paracetamol or drugs. Child comes with fever and we give antibiotic. Next fever, mother continues same prescription to save consultation charges and visit to a doctor. So mother has to be made aware of which drugs are safe in her hand, which are unsafe in her hand. She should know it. This I am giving for fever, reduction of fever. This I am giving for cure. You should not use it yourself. You can use this pure medicine yourself without asking me. If fever is giving trouble, then paracetamol is indicated. Having fever is not an indication of paracetamol. It's a time we should tell mother symptomatic medicine and curative medicines. Symptomatic medicines reduce the symptom, do not cure any disease. Common cold does not require any drug. It is self-limiting disorder. Most of the illnesses are self-limiting. Nature cures it. Medicines are rarely required. But mother cannot know. So, curative medicines, antibiotic, antimalarial, antitubercular, these are curative medicines and symptomatic medicines. Whenever there is fever, first response of the mother should be reduce clothing on the child. If you want to increase the body temperature, put on sweater, blanket, cap, hand gloves, foot gloves. If you want to reduce temperature of the child, remove clothes. Normal single cloth loose is best dress for a child with fever. So first response of a mother for fever should be reduction of clothes on the child. Second response, second step of management should be open the window, put on the fan. Well ventilated room, child will get cured. Ill ventilated room, child will not get cured. Fever will not subside in spite of all the medications. Heavy clothing and put off the fan and close the windows, temperature will not come down. So second step is well ventilated room. Third step is adequate water intake. All antipyretics, paracetamol, are diaphoretic. Antipyretics do not lower the temperature, do not cool the body. They induce sweating. And when this sweat evaporates, body temperature is absorbed, used for evaporation. And that is the mechanism of action of antipyretics. In presence of dehydration, however amount of antibiotics or antipyretics you give, they are going to fail. Because child is dehydrated. Body says you give as much paracetamol you want. I won't cause sweating. I am already dehydrated. Paracetamol action fails in presence of dehydration. So, mother has to be taught to hydrate the child. As a third step of management of fever by mother at home. Only water is okay. Water with salt sugar is okay. ORS is okay. As a principle, thirst is the first sign of dehydration. Thirst is the first sign of dehydration. Next step is paracetamol. In adequate dose, 15 to 20 milligram per kilogram per dose. Minimum 15 milligram per kilogram per dose. A 5-year-old child weighing 25 kg getting paracetamol 125 milligram is grossly inadequate dose. So inadequate dose is another cause of failure of paracetamol to act. So dose has to be adequate and mother should know at what age which strength of paracetamol preparation mother has to have in her home as a household remedy if required. All fevers do not require paracetamol. So adequate dose of paracetamol is fourth step of management by mother at home. Fifth step is tepid sponging. बाहर से सूखे मटके का पानी ठंडा नहीं होता, बाहर से गीले मटके का पानी ठंडा होता है. तुम्हारा मटका बाहर से सूखा है, उसको बाहर से गीला करो तो ठंडा हो जाएगा इवापोरेशन से. आफ्टर गिविंग पैरासीटामॉल देयर शुड बी टेपिड स्पंजिंग. वी शुड नो द डिफरेंस बिटवीन टेपिड स्पंजिंग एंड कोल्ड स्पंजिंग. Tepid is tap water and cold is cold. The traditional practice of putting salt water patti on forehead is not enough. It is in films, not a real management. Real management is गीले टॉवेल से पोंछ लेना या शर्ट गीला करके निचोड़ के पहनाना. वेट शर्ट और वेट फ्रॉक पहनाना तो सूख जाता है, तो सूखते टाइम बॉडी टेम्परेचर एब्सॉर्ब कर लेता है इवापोरेशन के लिए. सो द टेपिड स्पंजिंग और वेट क्लॉथ और वेट टॉवेल, रैप इन वेट टॉवेल. यहाँ पे लोग नहीं फिर ठंडी लगेगी, फिर ठंडी लगेगी, फिर तो उनको बताना पड़ता है. दैट इज ए इमेजिनरी वरी ऑफ ठंडी लगेगी, सर्दी हो जाएगी, एंड रियल वरी इज टुडेज फीवर. So fifth step is tepid sponging. एंड सिक्स स्टेप शुड बी अ डॉक्टर. लोग क्या करते हैं, बुखार है तो डॉक्टर, फर्स्ट स्टेप डॉक्टर. नहीं, ये 5 करके 6 स्टेप डॉक्टर चाहिए, ये लोगों को समझना चाहिए. और ये मदर को कैसे समझेगा, हम बताएंगे तो समझेगा ना. सो दैट इज आवर ड्यूटी. वेल ट्रेन्ड मदर्स मैनेज चिल्ड्रेन वेल. दैट इज द प्रिंसिपल बिहाइंड इट.